Hi guys, welcome to the Arthro Guy YouTube channel. I'm Dr. G, your Arthro Guy, a fellowship-trained orthopedic surgeon practicing in adult hip and knee reconstruction. In a previous episode, almost a year ago, I shared with you 5 annoying facts about total knee replacement. In this episode, however, I like to stay more positive and lessen some anxiety that you might be having about joint replacement. I'm sure that many of you have heard that total hip replacement can lead to great results. Do you know why though? Well, let's see. Today I can answer this by sharing with you 5 amazing facts about total hip replacement. Fact number 1. Patients sometimes get immediate resolution of growing pain after total hip replacement. Pain is gone in seconds. This applies mostly to patients who have been suffering for a long time and has significant bone-on-bone arthritis. Most of them suffer from extreme stiffness as well as significant pain with any hip movement, especially deep flexion of the hip and rotation of the hip. The source of the pain for them is this grinding and crushing contact between the socket of the hip and the head of the hip, generating significant inflammation and pain. So when this source of pain is gone with hip replacement, the pain goes away too. You might get muscle or incisional pain from the surgery, but that is often much better than growing pain from bone-on-bone arthritis. In fact, I have seen a patient crying a few hours after the surgery because his debilitating pain was gone instantly after the surgery. And there have been many patients who shared similar experience. And this is why I do what I do in specializing in joint replacement. There are not many elective surgeries out there that can lead to immediate resolution of pain like that. And guys, this is the amazing fact. Fact number 2, total hip replacement can improve your back and knee pain. Do you know what surgery you should do when you have both back and hip arthritis or both hip and knee arthritis? Hip first. One of the reasons why total hip replacement takes precedence is because you can get so much improvement in your back and knee after hip replacement. Sometimes you do not need to have back or knee surgery after all. You see, you have to understand that the 2 joints that are next to each other can influence each other in significant ways. Back movement influences how hip functions and vice versa. Similarly, hip movement influences how knee functions and vice versa. And hip joint is this linchpin, center of all. One study showed that about 40% of patients who are going through hip replacement suffer from low back pain. Of these patients, 80% had resolution of a back pain at 1 year, and 90% of them at 2 years. This study demonstrates that patients can get 2 conditions resolved with 1 surgery. And folks, this is amazing fact. Fact number 3, total hip replacement can make you taller. What? You heard it right. Total hip replacement can make you taller. The important word here is can. Hip replacement can make you taller, but it does not necessarily make you taller always. Oftentimes, the patient presents with bone-on-bone arthritis, making the entire leg shorter to start with. So what total hip replacement is essentially doing is to bring back the normal length by bringing the center of the hip joint where it's supposed to be. Furthermore, many patients have bad postures to compensate for severe hip pain. By relieving the hip pain with total hip replacement, the patient can have a better posture and can feel taller. Thus, by bringing the joint where it normally should be and by fixing bad posture, total hip replacement can make you taller. And ladies and gentlemen, that is another amazing fact. Fact number 4, total hip replacement can last a long time. In fact, the total hip replacement can last up to 30 or 40 years. Where did I get that number? Look at this study. This is the article from Lancet in 2017. After looking at all the case series and registry data in England, this study concludes that 58 to 78% of patients kept their hips at 25-year point, meaning that the majority of a total hip replacement can go beyond 25 years. I personally have seen with my eyes some of the patients who have kept their hips more than 30 years. You have to understand that these patients had their hip replaced with inferior and outdated implants. We now have implants that are superior in designs and properties. Some implants are designed to protect against dislocation and fracture, meaning that we can avoid early complications. Furthermore, there is a wearable part called polyethylene liner in total hip replacement. This liner has been gone through multiple generations of improvement to become highly durable, almost irresistible to any significant wear. Thus, we now have implants that can avoid early complications and late problems, leading me to believe that modern hip replacement can last up to 30 or 40 years. And that is an amazing fact. Fact number 5. We're putting all the information together to give you the final fact. Total hip replacement is being regarded as one of the most successful surgeries in this century. This is along with a cataract surgery and coronary bypass surgery. Ever since Sir Charlie pioneered the modern concept of a total hip replacement, this surgery has provided long-lasting, pain-free hip for many patients who had debilitating hip conditions. Technology has evolved. As we talked about, we now have implants that are projected to last 30 or 40 years. Benefits far outweigh the risks of the surgery. In 2007, it is no wonder that Lancet magazine claimed that total hip replacement as the operation of the century. And guys, this is definitely one amazing fact. So to recap, total hip replacement can be amazing because number 1, it can relieve pain immediately. 2, it can also relieve back and knee pain. 3, it can make you taller. 4, it might last forever. And 5, it is considered as the best surgery in this century. As a joint replacement surgeon, I provide total hip replacement for my patients. I use bikini incision direct anterior approach for most patients and use most modern technology, including robotic arm assisted technology in hip replacement. If you're interested to find out more about this, please check out my website, www.arthroguide.com, as well as my YouTube channel here. If you have not done so already, please subscribe. Please leave comments if you have any questions. Thank you for watching. Take care.